What's up, y'all? Ruben Davis, Future Doc here, and I'm super excited because today starts the first video of my inaugural series, Journey to Medicine, and today I got with me the Terry Everett, aka Dr. Durag. What's up, bro? How you doing, man?
Good, man. How about yourself?
I'm doing wonderful, man. I really appreciate you coming on the channel to share your story and to let people know, how you got into medicine and, to encourage folks, give some tips and all those different things. And really so people can just get to know a little bit more about you, man.
Man, glad to be here.
Instagram sensation, TikTok sensation.
I try.
All right, bro. So we're just going to start at the beginning of your journey.
Mm-hmm.
So you went to VCU for undergrad, and you stayed at VCU.
Yeah, my life.
All right, so what in your life kind of pointed you towards medicine?
So early. So my dad, he was a twice convicted felon, and my childhood was like it was good. We was turned, you know what I mean.
Mm-hmm.
But it was a good experience because like it forced me to have kind of a different perspective on life.
Mm-hmm.
As my dad looked for jobs, we had all the challenges you could imagine with like, being turned down from jobs and all of that. So my mom eventually decided to go back to nursing school because when she was pregnant with my older sister, she went to HU, Hampton University. And then I think it was either the first or second semester she had to drop out to then raise my sister. And then later on her passion came back for nursing. And so while it was my brother and two sisters and I, we would kind of help her with her information, like, quizzes, we make raps and all of that stuff. And then additionally, we would go into the neighborhood and give this like makeshift medical treatments, like, just kind of how to manage your diabetes, like, what your glucose levels should look like, what blood pressures like you should be in the range of, depending on what your doctor told you, et cetera, and just kind of taking care of the neighborhood. And that was really like my first introduction into like making medicine fun. And then in 7th grade, I watched the movie Ben Carson's Gifted Hands. Not being political, I don't agree with all his stuff, you know what I mean?
Right.
But I think
great
that
movie.
like, great movie, yeah. But like it gave me outlook on like, wow, like this guy can not only be a doctor, but also be like well respected, and then also well respected enough to make a movie about. And then they show us in a movie with a bunch of little bad teenagers, doing that thing. So that was very impactful for me. And then high school, I was just in high school. I was just like, just trying to make sure I stayed on the straight and narrow. So I never really was one of those people though. Like I admit to be like, I was in 5th grade and you see like under my yearbook picture, be like, I'm gonna be a doctor. Like it wasn't like one of those things. I just knew I always wanted to be something that was merit-based and then also gave me a consistent challenge throughout life. Unfortunately, this has been a consistent challenge.
I was about to say, you picked the one. You picked the right one for that.
Exactly. But that was pretty much my reasoning for like, medicine as a whole.
That's awesome. So where are you from originally?
Newport News, Virginia.
7'5".
Sorry.
From the 7'5". Okay.
Yes, sir.
But you was out there engaging in your community with your mom and your brother and everything. Helping the community be healthier. That's a big problem in the Black community in particular. So that's awesome. That's a great story. That's a great personal statement right there.
I was trying to think my personal statement for always think about it.
Yeah. Were you able to incorporate that well into your personal statement?
Yeah, I think that so with the personal statement, both for like medical school, I didn't really incorporate it in my medical school personal statement as much. I think because like I was trying to fixate myself to be who I thought I needed to be.
Right.
It all worked out for the best, and it was still personal, but it wasn't as like personal as what I like really wanted it to be. But then for my residency personal statement, like that to a T was like personal statement.
Wow.
So much so that like every residency interview, like that's what they said as soon as we got on the call. It was either that was like the best personal statement that I wrote, that I read, or that was the best letter of recommendation that I've ever read from the department chair, and that was based on my personal statement and then like the relationship I had with her. So it's not like a flex or anything, but it's mainly one of those things where it took me a lot to be that vulnerable in a personal statement, and then to be rewarded ultimately was, a great feeling.
No, I think that's insanely important to hear. Because a lot of people like to put fluff and like to put all of these things that aren't necessarily important in their personal statement rather than just talking about like, who are you, letting the admissions people know who you are and, how that contributes to you wanting to do this thing.
Yeah.
And so, that I think that's important for a lot of pre-meds or even, fourth years applying to residency, for them to hear like, it's okay to be vulnerable. They want to see that. They want to see the person you are and who's going to come to our program and, will you be a good fit? So
who are we getting?
Exactly. Who are we getting? So speaking of personal things, let's talk into this journey, this application journey into med school. Like, how was that for you? How many times did you apply? Let's start there.
Once.
So you want to?
I took a gap year though.
Oh, you took a gap year. Okay, what'd you do?
I did take a gap year. Is this thing going? I took a gap.
This your camera right here.
This thing going? I took a gap year. People are so scared to take gap years. I personally recommend a gap year, but I'll go back a little further. Like, my plan during undergrad was like, I knew I wanted to be something, I just want to be a doctor. After the first video, I told everybody I was gonna be a doctor, so I was like, I gotta kind of commit, but I still really wanted to do it. But I would meet with my advisor and I would say, what boxes do I need to check to be as prerequisites to get into med school, and then my experiences outside of like my curriculum and like my classes will fill in the rest of the gaps. So I took my gap year to mature as a man. Because like at the end of the day, like, even though we're on a very straight and narrow path, like you're still a brother, a sister, a cousin, however you identify, like whatever role you play in your family's life and all the other relationships and employee, etc. These are still things that like are still going on throughout your life because you're ultimately giving up your 20s to go into this profession, and you have to have that balance. And so during my gap year, it was a great year. Like skydiving, we was throwing pool parties, like we was like throwing bashes and paintball, like anything that you could think of. We was turned up on the mat. Turned up to the max. I loved my gap year, but I say that to say so many people are so scared because like the question I always get is like, how did you make your application stronger throughout your gap year? And it was because like simple things, like we would be at like, I'd be out with my guys and like we'd be in like a circle and we'd be like, okay, a game that we're going to play is we turn towards anybody and we say a color of a shirt and then you turn out and then you just got to go talk to whether it be like anybody like around, whether it be like a club, a festival, anything. And like those things were like the soft skills that I learned there. So when it came time to interviews, like it was money.
You're cool talking to strangers, all that.
Exactly. From like a logistics standpoint, though, I did scribe, and then I also worked as a server at seafood restaurant, Live Crawfish Seafood, 9020 West Broad Street. So it's like, but like those people were like family. So I've worked there since the semester before I graduated college, but then I also worked there. Like I still work there now. I'm supposed to be working on the 23rd this month.
Wow.
But it was like those relations and things like that. Like those were the important things. A lot of people scribe, a lot of people volunteer, shadow, etc. But like when it comes to like communicating who you are, like those are the experiences that'll allow you to do good on your application.
Yeah, and then also when you get into med school, you're on the grind.
Yeah,
not to say
med school.
Not to say you can't have fun, but the fun becomes a lot harder, a lot more limited. Yeah, a lot more limited. So yeah, definitely tee up. I didn't necessarily take a gap year. I did do a master's, which was kind of like a gap year. But yeah, a lot of people are scared of the gap years. But I got to tell people sometimes too. There's a woman in class of 2026. Who started in her 40s. She lived a full life and then decided, okay, I want to go to med school. And, she's still doing her thing, got a son, all these different things, and is still able to do this thing. So don't be too discouraged by taking a gap year or growing, because the average age is like 25 of like a first year. It's a lot higher than, fresh out of undergrad. Most fresh out undergrads don't really get in. Whether you got a 520 or not, there are a lot of 520s who don't make it in. So yeah, I'm glad you pushed that point. Gap years are okay. They're safe. They're good for you.
I loved my gap year. It's why I was able to do like well in med school. Literally.
Yeah. So let's talk about the MCAT. How was that for you?
I got bodied on the MCAT. Oh my gosh! The first time I took it, I got a 499, and then the second time I took it, I got a 507, and that's what I applied with and ultimately got into. I don't know if you shared your MCAT score. I don't know.
No, I shared mine. I have a whole video on my MCAT score. So I took it 3 times. My first time I got a 494, then a 498, and then a 511.
Oh, that's good. Yeah, he was way better than me.
Not way better, but it was a gap. So what was the difference between that 499 and that 507?
It was the same thing. So like with the MCAT, when I see pre-meds and they ask me like, how did you study for the MCAT? What did you do? Or like they get so upset that they got to take the MCAT. I tell them like literally the MCAT is literally, it's not competent based. It's literally so that you can learn what you need to do to be successful in medical school. And a lot of times it's not about the score. It's about the resilience from 494, 498, 511. And it's about the things that you learn throughout that process. Personally for me, I got my score, and then literally that day I scheduled it for 3 weeks later. So I only had like 3 weeks in between my gap year, in between my
two
score testing dates, and I just did more practice tests, bro. Like before I was
Y'all
like,
hear that?
practice tests.
That's actually insane, because that's the main thing I preach. Practice. I had a crazy schedule where I took a practice exam every 3 days.
That was my thing for step 2. I did that. And bro, like, we can talk about that later. Because we're MCAT right now. But literally, like, there's this fear that, like, I need to learn everything. So, bro, the first week, I read through all of the Kaplan books, bro, got bodied on the MCAT, bro. But then I went back and then I took the pre-test again and then just did nothing but practice exams. And in 3 weeks, that was like, because I actually got it. And I understood what they would be asking.
Exactly. Half the exam, really more than half the exam, is understanding what they're asking you.
Exactly.
You know, and there'd be little facts that you need to know here and there. But for the most part, do you understand what they're trying to get at?
What are they talking? What they talking about?
What they ain't talking about nothing.
They ain't talking about nothing.
No, that's dope. That's inspiring. Your journey so far is inspiring. I'm sure people are getting inspired right now. I'm getting inspired right now just thinking about it. And it's nice to hear, you know, because we talk, we know each other, but I didn't really know your journey in detail like that. So it's really cool to know that, you know, we had some similarities there for that MCAT, you know, because a lot of people, you know, we were just kind of talking about this off camera, like they see you doing these things and they're like, oh man, they just smart, they just this, they just that. They didn't have to work hard. They just one of those people that just get it.
Yeah, they just got it.
Right,
yeah.
But it's like that's really not the case for a majority of people. Now there are some people who are just broken in the brain. They just get it,
which is crazy to me.
Yeah,
Still crazy.
But the vast majority of people had to work for where they are.
Yeah.
And you know, you see Dr. Durag on Instagram, but you know what I'm saying, there's work behind that. There's a lot of work behind that.
Yeah, I'll just add to that quickly is that like I feel like for the people who have to actually work hard and it doesn't just come to them, they actually have a better work-life balance or a better quality of life a little bit later. Because like even with the Dr. Durag stuff, like even my wife said, you just get stuff for like, you know, my family members say, oh, Terry's always been like that. And it's like, actually, no, I haven't. I actually have to work like very hard to like get concepts and get things and not either get into the weeds or stay too broadly out.
Right.
However, consistently having to work and do that extra work, when you get a little bit further in your medical school curriculum, then things might look like they come easy because you already know yourself academically so well that you can then tack on a lot of your personal stuff on top of it. So I just wanted to add that little.
No, I appreciate that. This is what this is for. Providing the tips and everything for everybody and the motivation.
Yeah, motivation.
People to keep pushing. If you've been struggling through your journey, you took the MCAT multiple times, you're still trying to apply, you didn't get in, whatever. You know, this is that proof that, you know, you can do it.
Yeah.
You can do it.
You got to do it.
And so, how many schools did you apply to?
5.
5? Okay.
Yeah.
How many did you get into?
So I got into VCU first, and all of my siblings stayed in the same area, but I got interviews from like 3 of the other ones. And I didn't even take the intervs
You was
just
like,
because I knew I wanted to stick around. But then all my siblings moved to different states right afterwards. I was like, that's gracious, I played my part. But yeah, that's always like whenever people ask me that question, like they're like, oh, only 5. Bro, like I'm not gonna lie to you, I didn't do Reddit pages, I didn't do forums, I didn't really talk to my advisor for when it came to like applying to med school. A lot of it was just like betting on myself, and then also having that whole like ignorance is bliss concept to it, because like I didn't really know like what the process looked like, average amount of schools people apply to, all of those things. Right. But I was just going blindly, but just putting everything like in those baskets right there.
Yeah, I mean, and from what I'm hearing, like you had a great application. You had a great story. Was your undergrad, like, would you say you struggled in undergrad? What was your stats like in undergrad?
Nah, they I mean, they weren't like the greatest, like.
Right. But they weren't trash.
Yeah, they weren't trash. Like my GPA overall was like probably, I think either my overall GPA or like my science GPA was like a 3.5. Then you have the 507 MCAT. And I forgot what other like numerical statistics they stratify you on. But it was like I would say it was like a medium type of application. But boy, I sold that joint. Woof.
That's what
I sold that joint.
That's what's important. It's like you don't need the most outstanding stats. I'll say it's really how you present your application. Like, so you do need stats to get in the door.
Yeah.
At least one stat. Like, let's say you struggle.
See paper.
Yeah, if you struggled a little bit in undergrad, at least have a good MCAT.
Yeah.
Or vice versa. You did well in undergrad, or maybe you had not so great an MCAT. You know, that could still get you the door. Then everything else is what matters. The extracurriculars, how you paint the picture of who you are, the vulnerability you put in your personal statement. That makes you like, wow, this guy's been through it. You know, they really worked hard. They got perseverance, and even if they struggle in med school, I feel like they can do it because they showed me this. Right. So, you know, it's really about the full totality of it. And if you can get to build a relationship with a school, that would be even better. You know, if you do a program, like I know you see as like SAP and all these different things, you get to meet other students here, meet other, you know, admissions people potentially, and build that relationship. That also helps as well. And I have a whole video of that as well.
Check that out. Yeah, I mean, like so like I did something like I mean, it might not be very different, but like very like unorthodox from what like people were telling me to do was like, when I would watch a YouTube video, I'm like, how to like set up my experiences and like everything. Those, I think you get 15 experiences for.
Yeah, something like that.
Yeah, like whatever amount of experience you get, I told genuinely stories. Like it wasn't like I was the first president of the first Black Caucus. You know what I mean? Like it was like I literally like told stories. So like that was one thing that like people told me during my interview process too. Well, VCUs, they don't want to interview, but it was just like, you know, it was an emotional roller coaster, like reading your application. But because the reason I did that was because out of 2,000 applications a school is going to get, everybody's application is going to look the same at a certain point.
So how do you stand out?
Exactly. So if I can crack a joke within the first line, appropriate. But like, you know, if I can crack a joke or like, you know, grab their attention like on an emotional level, then like I can just reel them in so they can be like, I really want to meet that guy. Even if we're not considering him to go to the school, I really still want to meet him. And then you get your foot in the door and you take care of the rest.
That's it right there. How can you get them to read your personal statement or information and be like, yeah, I need more information about this. I want to hear them talk about this. I'm just going to give them an interview just to talk about this topic, and then you connect, and then all those other things. So that's awesome right there. I feel like there was a lot of sauce in there.
Yeah, a little sauce.
A lot of sauce in there for y'all to grab that as y'all apply to school. But let's get into med school. So now you're in med school. All right. How was this journey been for you? Like, what was that like?
It's been amazing. I would say, like, you know, as you can attest to this, some things are easier than you thought. Some things are harder than you thought.
Amen.
A lot of things harder than you thought. But like a lot of it, like, you know, you grow with it and then like you figure out who you are. I would say like my experience would not have been anywhere as good had I not been my wife. The first semester, I forgot my ring, babe. I gotta say this because I wear a silicone ring to the gym. So I took it off in order to put my actual ring on, but then I had to take the dogs out. So I forgot it. So I just want to let that be known.
No, it's okay. It happens.
Yeah, it happens. But, and we can talk about that like a little later. I don't want to like kind of get us too far off course. But I think that like meeting my wife the first semester of medical school, we butted heads a lot in the beginning. Just because like she would be like, you don't understand. I'm like, girl, you don't understand. I got school. I got anatomy lab next tomorrow. Like, you know, but the thing is like she was the person who influenced me or made sure that I kept my humanity about myself. And the same thing with Destiny for you. Like, you know, it's not like 100% medicine or like 100% medical school. So you have like some type of different mind of like a frame of reference about your like world. And she just kept me grounded. Like this is just to make it feel like this is just a job, like you know, a passionate job, obviously. But like, you know, you got to be able to separate.
Exactly.
So yeah.
This is not our whole life, and definitely, my wife definitely keeps me grounded and keeps me honest and on task. You know, because I'll be tweaking sometimes. Yeah, you know. And she'll let me know, like, hey, like
you're the corner like this.
Like, yeah, you good, and just supporting me through things. You know what I'm saying? When she knows I have a busy week, like we have a joint calendar, so you know when she sees I got a lot going on, you know she's doing things to support me, and helping me, you know, maintain balance and all that. So how would you say you were able to find balance throughout med school?
Definitely, like one thing that helped us during undergrad, like we was talking about, like I already was waking up at like, you know, 5, 6 o'clock in the morning. And so for me, it was like making sure I got things that I wanted to do that had nothing to do with my wife done before I got to school, getting the things done outside of school that had nothing to do with school. So like basically like partitioning my time to make sure nothing overlapped. My schedule was the same day every day. Like say I get up at 5 o'clock in the morning while I work out, I don't listen to music. I listen to like those motivational podcast things and like those like small clip videos like Mike Tyson and David Goggins and all of that. But it really put me in a frame of reference to feel like I can take the day or take control of the day. And when it would get to points where like I would doubt myself or like I'd be like, no, I can't do this. Like my internal thoughts then became the ones of the motivational speakers. And so like that cascade or Rolodex of things kept playing in my head. So yeah, I would say that was like my major thing. We can talk about it a little bit more, but yeah.
No, that's cool. So I actually want to dive a little deeper into your schedule, because I feel like that's the hardest thing for me of like scheduling my time, making sure that I am like able to work out, you know, just relax and you know, not worry about nothing, not my school, not my wife, sorry babe, you know, like just the dog, you know what I'm saying, where I can just have time to myself, not thinking about anything. And that's, I feel like, one of the harder things to do, because you always feel like you have something to do. So talk about your schedule a little bit more. So you say you start at 5 a.m., then you go throughout your day, like let's say throughout your preclinical years, right?
Okay.
Where you have classes and things going on. Just kind of break that down a little bit deeper, how you really balance that.
All right, so the way it would be is, say I got a rotation at 8 o'clock in the morning. I wake up 5 o'clock. Let's see. Okay, we can do 6 o'clock since it's 8. So I wake up 6 o'clock in the morning. I'm at the gym by 6:15, 6:30. I work out for an hour, puts me at 7:15 mainly. Take a shower at the gym. So my gym bag is full of everything. I need to shower at the gym. Y'all go to AmFam now?
Yeah.
I think I see you leaving one day.
Oh, word?
Yeah, that's not even there. But like, you know, take a shower. I'm out of the gym by 7:30. Going to class in the morning. So I get there seated, ready to go by 8 o'clock. Taking notes. I use OneNote so I can actually like draw illustrations on the side of like the actual PDF for the 4 hours. Have a 1 hour break from 12 to 1, from 1 to 5, excuse me. I'm making like Anki cards from the notes that I took and the notes that the lecturer had given. And I do an hour each lecture, so 4 hours there. Get home, I probably in about 15 to 20 minutes so I can account the time driving home. Get home, have a break between like 5 and maybe 8 o'clock. That's wife, dog, like whatever. Excuse me, and then, maybe like 30 minutes to an hour max. I'll like 2 times speed of Boards and Beyond video, or just something so like the first time I'm hearing stuff in class is not the first time I'm hearing stuff in my life.
You was a pre-read, pre-lecture kind of guy.
Yeah, but it would be like, you know, we watching TV and I got an AirPod in and it's kind of like I'm looking at it just so I can kind of get familiar with like the flow of the day. And then I'm in bed by like maybe 10 o'clock, 10:30. So I still get my 7.5 hours sleep. I don't play by my sleep. That's one thing. You know, I'm optimal between 6.5 to 7.5, but 7.5 is like bread and butter. Anything afterwards, I get slouchy. And I do that 5 times a week. On the weekends, I'll get up a little early. I'll probably get up at 7, go to the gym, be ready to study about 9 o'clock. Study no more than like 3 to 4 hours in the morning. And then like, you know, that's butter. But like I'll go out and like, pre-clinicals year, me and Kayla would go out and go to the club, something like that, go out with friends, hang out Friday nights, Saturday nights too, depending on what we wanted to do. And then Sunday we'd meal prep for the day and then reset and get ready for the week. So I still get to, like, you know, I'm still on the gym. I still get to eat my meal prep and make sure I'm healthy. Still get to eat like trash on the weekends and enjoy my time. Still get to go out and like have fun. Still get to spend time with the dogs and like all of these things. So it's just a matter of like, you know, being intentional, but then taking time to account for like small things like the shower at the gym, or like, you know, if I got a long walk to up a lot, I gotta walk up that hill, just things like that. But I'm very regimented in like my schedule. It's giving me the most freedom, as you said earlier.
Yeah, it's like you gotta, if you want to enjoy your time, you gotta manage it.
Yeah.
Well, you gotta lock in and manage it. I'm not the best manager. I know what I should do sometimes. Sometimes I don't always do it, but when I do it, I'm so thankful. Like, wow, I actually have time now. Like when I would actually schedule out my studying, I would be like, once that time was over, I could relax. I'm like, I studied my time and I put in the work, especially if I did it consistently all week. I'm like, I put in the time, so I don't need to cram 10 hours.
Exactly.
You know, because I've been incrementally doing it. So so yeah, man, you kind of built though. You built different. With the early mornings and stuff like that. I'm not an early morning guy.
No, you kind of like get used to it, and then like you see the difference, like even like the amount of mental clarity you have going to class. Like basically like compared to other people, like you're on like the same way that you're awake at like maybe 10 o'clock or 10:30 is what you're coming to class, like starting class with. So then like, you have that 4 hours to get what you need to get done, but you're like attentive, like you're like focused. And plus like I would try to limit like my coffee to like probably after like when I study in the afternoons. But like I'll take like half a scoop of pre-workout and that'll like last me throughout the first like
pre-workouts.
Yeah, you get a kind of like, what do you say?
Got you juiced up.
Yeah.
So what was your hardest block for preclinical? If you remember, I know that was 4 years, 3 years ago.
I would say biochemistry. It was two, but for different reasons. Number one, biochemistry, because that was the first one.
Right.
And I pulled up the class and I'm like, bro, like
that
was a semester worth of material in the first 4 hours of class.
No, facts.
Yeah, that was definitely difficult. But then like you get past the learning curve and then like you trial and error, you figure out, what mistakes you made and like figure out ways past it. And then physiology, just because that was the one directly afterwards. And that's the one that you realize that like, when you finally get to understanding how you study here, it's a whole different ball game, this next block. So I would put those as the top
your first two was the hardest, and then you started to
haymakers is every
you started
day.
to catch a groove. I'll say MSK for me.
Yeah, that was weird with the pulley joint that they had. Like, I don't know if you remember with the weight and iso volumetric.
You talking about with the
contractions and everything. Yeah, that was pretty difficult for me.
Yeah, MSK, because I didn't really like ortho that much. Like I just didn't like the concepts. And then endocrine, because there's just all the feedback.
Yeah, I actually rock with endocrine. I like endocrine because I also really like organic chemistry because it was more like, I get to practice with it.
Right.
But yeah, MSK was like weird.
Yeah, endocrine. It was cool. Like I didn't hate it, but it was just like remembering like when they give you vignettes, you got to think about, okay, if this is happening and this isn't happening, then what do you do? Like thinking it all out sometimes was a little difficult, but hey.
Yeah.
So
we
then we here exactly. So third year rotations. What was your hardest rotation? And I guess, if you want to talk about rotations in general, like any tips for that?
Yeah, I would say internal medicine probably was the hardest. Just because it required me to think so much, and then you constantly been put on the spotlight for rounds, and you're sitting there, people looking at you like, God dang it, I mean, you're not prepared.
Right.
And I think that the reason it was difficult because I had family med and then I had psych, so I wasn't already like indoctrinated into like the full groove yet. So that was my first haymaker. But then after a while, like I started getting the groove of things. Also, I would say it was the most difficult because that's where I had my turning point into like how it should actually be. And so for the most part, like, I'm trying to figure out the best way to say this, but like I stopped being like, who I thought I should have been. And I started kicking it with the patients. I started like, seeing like meeting other people, making connections. Like, we during rounds, patient come through the middle, dap me up and then like, keep it moving. And like, I actually like realized that I was actually a cool person in medicine. Like, and like for people specifically, like, Black like medical students or people who aren't necessarily familiar with the environment of medicine where nothing really looks like you, to see that you're like so accepted, that's the moment where everybody takes off. And so it wasn't the curriculum, it wasn't the UWorld questions that I had to do for internal medicine, which was a crazy amount. It was the fact that like I finally like broke free of like this whole like archetype of what I thought I should be. And that took a little bit of time to kind of get used to, but it was a very huge leap of faith that I took to do so. And man, it was rewarding because I actually liked medicine now. Like, people be like, oh, I got to pass. Yeah. Like when you got to go work a 12-hour shift and then come home and do 340 question blocks of UWorld, like it gets daunting. But like once you finally like personalize it, man, I vividly remember that turning point. That was a good time.
No, that's awesome because I'm kind of experiencing a similar thing in only my first rotation, second week, where the first day is just me like, what do they expect from me? Like, what am I supposed to be doing? Where are my deficiencies? Like, so I don't look stupid. But then after that, it's like, okay, how can I continue to ingratiate myself with the patients and with the doctor and everybody to like. And just relax. And I feel a lot more relaxed now, just trying to be myself. And I find that being myself allows me to show up better. It allows me to even, interact with patients better instead of trying to like like lock in on these differentials like crazy. You know what I'm saying?
Algorithms in your head.
Yeah. Because it's like on the one hand, it's like this is my first rotation, and I'm only still a third year. You know, I can't. You know, lowering some of the expectations for myself. Not to say that I'm just gonna, you know, not do well, but lowering them just a little bit, not trying to be perfect, but and just really
figure where you need to be and
allowing myself to figure it out.
Yeah.
So yeah, I'm glad to hear you say that, man. I'm gonna definitely try to take that on when I get to internal medicine in like 3 months.
The apps. So like, just like some words of advice, like internal medicine and honestly anything where you're following patients, internal medicine, surgery, inpatient psych, like anything inpatient. Make sure like you use like a digital, I would say like a tablet or something is fine, but something where you can track and trend all of your patients' values so that you can have it readily available on rounds. So like a snapshot of like, you know, their BMP or CMP for the day, and then like you can refer back to see, okay, what has changed? How does your management like change like based off of that? And then also like use the apps. Lanthier has like a really good one, the ACLS protocol, like certain things were like, when you're walking through the hospital, when you're in the team room and you're walking down to see an admission in the emergency department or something like that, use the app to kind of not think for you, but use it as an adjuvant to say, okay, well, like this is what I was thinking. What else should be considered? I know that it's hand, foot, and mouth disease, but I would at least like to have certain things to see, okay, what else should I be thinking about? Because that's the point of the difference between the first 2 years of medical school and the second 2 years of medical school is that the patients are not the textbook. So when they say anything could happen, anything could happen. And so kind of like making sure that you're thinking about every single thing. It's okay to lock in on a diagnosis, write that down, but then try to come up with like 3 to 4 other ones. So you can constantly be thinking about those zebra things that, you know, you'll think you never see again.
Yeah, and I'm learning now. It's like, you really got to lock in. And there's just, and even in family medicine now, there's so much stuff that I'm like, I ain't never seen before. They don't really
family
teach
medicine
us.
is worse, bro. It's so much worse.
They coming in with some of the randomest stuff, you know, and everybody's seeing all these specialists. It's a lot, but you know, just learning, just learning, and let the experience be your teacher.
Oh, another thing of advice. I made a point, but like another word of advice is, so like typically a lot of people, like I did it too, myself included, I would watch a Divine Intervention podcast and like do a bunch of like podcasts closer to the end of the rotation whenever it was coming time for the shelf exam. Bro, start those in the beginning. When you driving to work or like you driving to Charlottesville or something like that, I would usually save like the first like 15, 20 minutes to listen to like a sermon or like some like sermon snippet, just to kind of like, that'd be the first thing I listen to for today. But like those kind of, I don't even know what they call, like podcasts for like step studying or something like that, but it's specifically for that shelf exam. Listen to that from day one and then just keep listening to them over and over and over again. So by the time you get to the end, you already know and you're just listening for familiarity, because as opposed to like listening to like, what did I miss this month? I'm not like, you bro didn't teach me. And that was a game. After that, I started honoring all of my shelves. Yeah, that was a game changer.
Oh, hey, I'm locked in. I'm glad I'm only in my second week now. I'm locked in. I'm about to lock in on these podcasts.
Yeah, family medicine bodied everybody. That was my first joint too. I got by on the hair of my chinny chin chin.
Yeah, I keep hearing that family medicine is a tough one.
Yeah.
And I'm a little nervous about that. We can talk offline about some,
we
some of your resources and things like that. All right, so you're also known as Dr. Durag on Instagram. You know, making raps and educational content. So where did all that come from? Where did all that start?
Well, so from like the videos that me and my brother used to do, like, and my friend John used to do like way back, I always did my separate video, like I always did my separate songs. Just cause like I'd be in class and I'm like, I'm already making mnemonics for it. I might as well just like turn it to a song or something like that. But my first song was Photosynthesis. Absolutely garbage. And then I did a transcription and translation song, and the song was actually good, but then I watched it and I was like, yo, this is wrong information, so I had to delete it. That joke went up for like 3 years. I'm like, oh man, oops.
That's embarrassing, bro. I'd literally be like dead inside. Like,
let's take that back, kid. But then when I got to medical school, I realized like a lot of things, like you would think in your mind, like you talking to a patient, they say something, you'd be like, that doesn't make sense. But it doesn't make sense because they didn't have the information. Just as like when I got to medical school, I didn't even really know what like a stroke was for real. Like it's certain things that you just don't know because you've never been exposed to it. And like with health literacy, I was like, if I can change this information to more so like medically related or like common comorbidities, get people to like see a general overview of what these things are so they can be inclined to go ask questions to the PCPs or like whoever like specialists they go see. Look on UpToDate or like some resources to figure out like, you know, what is this he's talking about? My doctor said I might have that, but what are these other words that he might have said? And this is just literally the pathophysiology of the condition.
Right.
And then Dr. Durag itself specifically started because I was recording a video and I left my Durag on. I was like, I'm not recording that again. Like, I'm not recording that again. But then you get subconscious because like I came to class with a Durag one day and I was like, oh, I know they probably thinking I'm, I ain't even gonna say it. Like, you know. But then like, you know, with that, like, you know, it's a lot of young, intelligent people like Durags, bonnets, etc. that like you might judge them on first look. But my thing is like, I really want to take away that negative stigma attached to it because like, you know, it's a big brain under that Durag now.
People in Durags can be doctors too.
Exactly.
Be lawyers, engineers, whatever, you know.
Yeah, it's just the shiesties you gotta look out for. It's like,
no kizzy, bro. No kizzy, bro. Look out for the biggest. Hey, if they got a shiesty and a fanny pack, bro, walk the other way.
Yeah, especially if the fanny pack go crossbody.
Oh no.
Yeah, there's a weapon in there. It's like, he's a criminal. So
I'm weak. I'm weak. Oh man. So how has that helped you in your journey? Like, what have you seen since you started that? I
would say it's been pretty cool because like I'm a medical student now, so like don't ask me for no medical advice. Like, you know, don't ask me anything. But you have a wealth of knowledge that you can share,
right.
And it might not be like, you know, what's the active ingredients in Ozempic, but you know like things about people's condition that you can share.
Right.
And when I release videos and like number one, like, you know, young kids are coming to me and be like, yo, like this really motivated me to like, you know, keep going, and like I see you doing what you're doing, and like it really pushes me to like continue on my path. You know, that really warms my heart. And then like, you know, having people, so make sure
you straight, you good.
But then also having people message me and be like, hey, my mom said that like she had this, or this is the case, then like, can you make a video about X, Y, and Z? Like, of course, if I can do it and like make sure I have like evidence-based medicine and things that I can back up what I'm saying, of course I would do it, because like truly my specific target audience is everybody, as long as y'all want to see it. But like my target audience with the videos are like what I've seen a lot in elementary school is like young kids who were raised by their grandparents, who their grandparents were a lot older and like they had these conditions. And so like, you know, grandma passes out on the floor, she doesn't have a pulse, and like you don't know how to do CPR.
Right.
So it's just like, you know, you just ride to the beat and then just like, you know, do something at least so the ambulance can come, or you can save a life just because you heard a song about it.
So you scrolled on TikTok one time and you saw Dr. Durag teaching you how to do CPR, and now you saved their life.
Well, that was trash. Wait, let me go find that again.
Right.
Yeah,
No,
so
that's awesome. I would say, like, you know, I've thought about doing that. I got some drafts of, you know, some YouTube videos about that. I got a whole series I want to do. But the biggest thing is like, one, some of these topics are really big, and it's like the scary part of like, we're learning all this information, but it's like, I want to make sure I'm as accurate as possible. Some of these things are controversial. Like, my big thing is I want to talk about factual information and not necessarily all the controversial information.
There's so much people who just put stuff out there.
Right.
Yeah.
And then, but what I've learned, and what I think is so important, what you're doing with the health literacy is like, for example, I'm in med school now, so I'm like realizing all these things. Like, my dad has hypertension, diabetes, but and then like the Black community in particular, we just kind of assume like you're gonna get older and you're gonna get it.
Oh my God, bro.
And like I realized, I'm like, wait, that's just not the case.
It's a disease.
It's a curable disease.
Exactly.
You can reverse diabetes with, you know, healthy activity and different things, the way you eat, all these different things. And I started to realize that, and my family doesn't really realize. It's like, oh, he has diabetes now you got to take medication for it. But it's like, no, it also means that cake he's trying to eat, he can't eat that cake. I'm snatching that cake.
Stop cooking that.
And then my family's like, why can't he have the cake? I'm like, he's a diabetic. But in it clicks, I'm like, they don't get it. They don't really fully understand what that means. It's like, you know, they see you drink some Kool-Aid, like, oh, that's diabetes. Like, yes, but sweet, right? But it's like really understanding what diabetes is, how you're supposed to change your lifestyle now that you're a diabetic. Because I'm like, you know, he has neuropathy and all these things. I'm like, sir, that's because you didn't do anything about it sooner.
Exactly.
And now that I know it, so when I see him, and now I actually talk to him about it. So when he sees me, sometimes he'll unprompted prompted, be like, oh, he'd be like, yeah, my A1C was this time. You know, my sugars, look at this. He's showing me his phone because, you know, he has the little the monitor, showing me like, I've been under, you know, I've been under 150.
And they proud of that.
Yeah, exactly.
Yeah.
It's because I've been challenging him like, hey, what's your sugar this week? You know, I'm calling him like, what's your sugar? Because I actually realized now I'm like, I can't just do this for my patients.
Yep.
I got to do this for my family because there are no doctors in my family, not a one.
Yeah.
And so it's like, that kind of one of the reasons why I wanted to do that, so I can provide that for my family, provide that knowledge that just doesn't exist in my family in a lot of Black communities. So that's why I just want to say kudos to you.
Yeah, I mean, same
for
here,
doing
brother.
those things because it's
15-minute appointment is not enough to tell somebody what polyneuropathy is.
Not enough, and not enough for, and people gotta changing people's minds about habits they've had their whole life takes a while. So keep doing what you're doing, man. Keep sharing it, and everybody out there, you know what I'm saying. Support your family with these conditions. Don't just enable them, you know, get over that hump. So
educate yourself too, educate others, and a lot of the times know it's going to be an uphill battle because, you know, you can't just go in there and smack the cake off the table and everybody going to invite you back to the cookout next year. You got to kind of baby step it.
Exactly.
You know what I mean?
All right, let's moving on to the next step in your journey.
All right.
The big doc, future doc. Almost give it what, like a month now, or
it's crazy they let me do this.
They let me be
I'll take it.
So you're almost there. Future doc, soon to be doc.
Yeah.
What led you to anesthesia?
Oh man, I think like going back to like talking about my wife. Going through med school, especially meeting her so early, I've always had the frame of, I was always speaking from a frame in which I'm looking at my life and not just 24, 25-year-old Terry, but what is dad 35-year-old Terry going to look like when I have a kid? Like, how available am I going to be to go to like sports games, like how involved can I be? And then also while I'm at work, how much can I love what I do? And so like internal medicine was a very difficult rotation, but I really liked it. Like I really enjoyed it, but it wasn't procedural enough for me personally, but I really liked the thought process behind it. And then I got to my surgery rotation, which was subsequent to that. And I love surgery, but boy, I had plantar fasciitis, and I was like, I can't be standing on. I was popping an ibuprofen 800, Johnson.
Ooh,
yeah, I know.
Extra strength.
Probably take the pain away. But then, like one day, I was looking at the. I got there a little bit early because I would always come a little bit early to try to help with transfer and everything. And anesthesia team, one of the guys came over, really like athletic dude, very nice. He was like, hey, like, you know, if you get it, I see that you're here this week with us, because it was my second day that weekend. He's like, if you ever get some time, you want to like hang out, like you can come behind the drapes and kind of help us set up. Because he see me looking stupid. I didn't know what I was just sitting in the corner. Because you can on Instagram, you be like this, like med student, but then the whole time you just sitting in the corner, like looking lost in the way, essentially. So then as we went through the case, I remember we had to do a right ventricular, like we had to do a tricuspid valve replacement because the patient had an abscess, like in her valve, or the wall of the valves. Then they take it out, and then they realize that the circumference of the valve is not big enough to be flushed with the actual area. And so we had to take it out and do it again. Oh my gosh. I was in there for 14 hours total.
Oh my God.
And like after like 4 or 5 hours, like you see the anesthesia team, they joking back there, they laughing, they switching in and out, taking breaks and everything. And I was like, I would use the bathroom every once in a while, but I gotta get undraped and then
you gotta redrape.
And I'm like, how are y'all, do y'all got a Foley in them? How are y'all not using the bathroom? This is my third time. Like, it's crazy. But I really like the OR, but then like I seen like people really liked what they did behind the drapes. And so I started rotating, and then when I was in OB, I rotated with the anesthesia team and followed them, and Dr. Shilin Thacker was a huge mentor for me, laid out kind of like the blueprint for me. And then I just started networking like crazy, and everything I did in anesthesia, like I really liked, because I hated like didactics, but in anesthesia, everything comes back. And it comes back great because you actually are doing things in real time, like especially like pulmonary physiology, even renal physiology, cardiac, like everything you're doing is like
tidal volumes, reserve,
bro. And I'm sitting on my phone like just hoping he'll ask me a question.
The FEV1 was what?
Exactly,
know,
exactly. But it comes back now to the point where like I know that stuff, and I didn't really understand it before in the first year and a half, but like. It was just, I'm a huge proponent for anesthesia. Now, like, it's getting, like, super competitive. I got people in high school talking about, like, I want to be an anesthesiologist. Like, how did you even know what that was? I didn't know what that was. I didn't know what that was. But yeah, man, like, I mean, that's a bunch of hoopla, but like, no complaints. No complaints.
No, that's awesome, because that's kind of how I'm thinking about it too. Like, you know, I want to be there for my wife, want to be there for my future children, and you know, what specialty can I enjoy all the bread and butter of what they do, but also be able to enjoy my life and not be strapped to the hospital. That's gonna be difficult, because I want to do procedures too, and I'm like, is that surgery? Is that cardiology? All these different things, but the call is crazy. But
and you figure it out like third year. Like, that's why I always tell people, like, you know, you don't really figure out what you want to do until third year of medicine, because what you might want to do, like, on the day-to-day might be really, like, fun. However, like, you meet people and see what their lives look like. And, like, there was this one statement, it's like, if your favorite place in a world is the OR, then be a surgeon. But if your favorite place in the hospital is the OR, be an anesthesiologist. And like, over time, I really got to understand what that means, because like, they can work a week on ICU and like work a week off, or like take time off and like, you know, do certain things, work in a PACU, work in like other areas. And it's just like so much variety to the brand. And then like seeing all of the people who I related to the most, and like I would do the eyeball test and like see like how happy are they. Anesthesia. It was just some cool guys, chill guys.
It sounds like, because I've heard this statement too, like, you just know your people. You just know them, and it seems like you met them, and instantly it's like, y'all are my people. Like, I really vibe with y'all.
I needed this.
You know, I'm over here struggling with the surgery team, but I want to see what they got going over there. I'm trying to hang out with y'all.
Exactly.
No. Awesome. So, you know, congratulations are also in order.
Appreciate
you and your wife expecting a little one, a son, right?
Yeah.
Congratulations on that. Congratulations on that. Due on my anniversary, actually.
Appreciate the Rich.
Oh yeah, of course. We got to support, man. It's a village.
It's a village. Yeah.
So with that coming up, being that she's due in the middle of your residency, because you're going to start in July, correct?
Yeah.
So, you know, she's due in the beginning of that.
I know. Yep.
What are your thoughts going into it?
I'm absolutely terrified, brother. I'm so scared right now. I think it's one of those things where like, it's the most like beautiful thing ever. Like, I'm nervous, I'm scared, I'm super excited. Like, I have all of these emotions. I'm like confident, I'm like not confident. Like, it's all of these things. However, like, whether in medical school with my wife, and not just medical school, but like, there's so many things that like were behind the scenes that were happening, whether it be with like, you know, family, with my housing situation, so much things that like could have literally just like made me fall apart. And we weathered that through medical school, unnecessarily, in my opinion. Like, but that's what God had for me. I take it, but it made me stronger, you know. And so like, I think that those things came our way so that we knew that whatever we were faced with, we'd be able to not only get past it, but like we would excel at it. And I don't want to speak like arrogantly and say that like, oh, that'd be nothing, you know. However, like the communication skills that me and my wife had developed, the schedule, the order we have in our household, the fun that we have, the making sure that like we're always accounted for and like taking care of each other, like those are the things that I'm looking forward to. And I feel like that's what makes us as ready as we can be right now. Because we got a puppy in the middle of medical school too. And that was difficult, but it was because we wanted to see what strengths and weaknesses each of us have as a team. So then by the time we come to having a kid, we can like kind of figure those things out. And so obviously a kid is so much like more, but I'm super excited, man. Like I'm scared boo-boo-less. Can't say the word on camera, but like I'm super excited. It's gonna be very difficult, but you know.
Yeah. Well, you got it, man. You got it. And look, you're still gonna be around. And so if you need some help, man, you know, I know you got family around too, but you know, maybe not me so much, but Destiny at the crib, you know what I'm saying?
Right at the porch.
No, and she's babysitting my niece and nephew this week.
Oh, wow.
I had four actually of my nieces and nephews for a week. Before I started rotations, and it was crazy, but it was actually nice because I grew up in a big household, so it kind of felt like that familiar. For me. I'm kind of used to that. I love the chaos and the noise around. I kind of see why my dad liked it so much. I'm too much like my dad. Anyway, that was me going on.
Later.
Yeah.
I love my dad.
No, I do. I love you, pops. But you know, I feel like we could talk for hours, man. Like you've dropped some gems.
Appreciate it.
Your journey is inspiring. just congrats on to you and everything you've accomplished going forward. You know, big ups to you, and I hope everything goes well for you in anesthesiology with your baby, your wife, everything. Praying for safe delivery, carry, all that type stuff. So to end this video off, you can look into that camera right there, and just whatever a piece of advice you want to give to pre-meds, med students, residents, whatever, you know, whomever, just the world in general, you know, what piece of advice would you want to give to them going through this journey?
So I would say like it'll be very broad and very vague, but like when the time comes, you'll understand like what it means. And it's like, it might sound cliche, but like, just do it. There's been a lot of situations and things in my life where like things have been going on. I'm thinking about what people would think. I'm literally about to apply to residency within the next year, and I start and I get on Instagram and I rap with a durag on my head. Like, it's just like certain things that you think that in reality it sounds stupid. Like, it sounds like very bad, but like a lot of those things where I just took that leap of faith and be extremely vulnerable and like make those minor adjustments to portray like, my vulnerability. Those are the things that have gotten me to where I got into. My experience I don't think I have an experience similar to like any of my classmates or like any of the people that I went with along the journey, and that's going to be your reality. You see people and like, with Ruben, and like every once in a while you meet somebody with like a very similar story, but like don't be disappointed if you don't. So like in those moments, look to people for help, but don't always look to everybody for the final say. Always pray about it. If you are religious, sit on it, think about it, talk to family members who are like want the best for you. And then in the end, man, just pull that's a crazy word, but just do it. I was like, shiesty on, but like, just do it, and do it with as much faith as you can. And when you fail, because you're going to fail, figure out how to lose, figure out how to win, and it's only preparing you for being at the top of the mountain. So.
Awesome, man. I appreciate that. I appreciate you guys. This is the Terry, aka Dr. Durag, aka future Dr. Everett, on the show. Appreciate you, man.
Hey, all love, man. Appreciate you having me.
All right, and then look at this camera and say future Doc out.
Future Doc out.